I want to talk now about infections, and my button up, pointed at the back. Okay, so this is from Winnipeg. We looked at all our patients at their initial immunoglobulin levels. The IgG level, which is a predictor of risk of bacterial infections, is reduced in 25% of patients at diagnosis. And with time, this immunoglobulin level will drop, and as it drops, then it increases the risk of infection. Low IgG levels are particularly associated with sinus infections and with pneumonias, but it can be really any type at all. But those are the important ones. Usually the level of IgG, it varies according to what you read. We use a cutoff of 3 or 4 grams. We follow the gammaglobulins in our patients every year, and you should be aware of yours too. We follow it every year. If it goes to below, usually if it goes down to 3 or 4, then we look out for infections. And the tip-off for us is if you have required intravenous antibiotics for infection, or if you had required antibiotics for more than 2 or 3 times a year. It's not just getting a cold. You need to have a significant infection. So if that occurred, we would place you onto gamma globulin. And Erin tomorrow, who's a research nurse in our clinic, is going to talk to you in greater detail about it, but about our program. But one of the problems with gamma globulin is that the literature and what you've read, I'm sure, is very fragmented. There's no sort of good, firm guidelines. And it's partly because treatment has changed over time and the effect of different chemotherapies can influence it. So many things can affect the ability to have infections, chemotherapy, the gamma globulins, whether you're in remission, etc. Lots of factors. Now, you can give gamma globulin, so that's generally what we do, and about 5 or 7.5% of our patients are on gamma globulin at one time. We usually use subcutaneous gamma globulin, and because patients find it more convenient, they can carry the gamma globulin with them if they go in Winnipeg. A lot of our patients go to warm places in the winter, so they can take their gamma globulin with them. And it can be kept at room temperature, and Erin teaches them how to administer it to themselves, and they do that once a week. So it works quite well, and for our perspective in the Cancer Centre, it's much cheaper, so it actually saves quite a bit of money. And the reason, because of chair space, and we actually use a lower amount of gamma globulin. The other things are the value of vaccines, and this is always how beneficial they are. It's difficult to know, but we certainly recommend that you get your flu vaccine every year and to get a pneumococcal vaccine as well. Don't take the shingles vaccine. It's amazing how many of our patients that go to their family doctors and they try and persuade them to get a shingles vaccine. Even more bizarre is that patients get shingles and then they go to their family doctor who gives them the shingles vaccine. They've already been vaccinated, they've just had shingles. But so avoid that. There is going to be a new vaccine which is going to be not a live vaccine, so that'll be safer. And I think Erin's got lots more. This is one of the pictures she sent to me, but I think she's got some to show us tomorrow, one of her husband being injected, so you're going to see his abdomen tomorrow. So the one thing that you do, probably the commonest side effect with the subcutaneous gamma globulin is the skin rash at the site of injection. But a lot of the other side effects that they get, like the flu, or you may experience flu-like symptoms or muscle aching or fevers, you don't get with the subcutaneous. So anyway, I'm going to move on now. One of the last point was the lenalidomide, and as Dr. Keating will probably talk to you about, lenalidomide is one of those drugs that can improve the immunoglobulin levels and could improve T cell function as well. Now, Dr. John Bird is the pioneer or the champion of ibrutinib, and he feels that the immunoglobulin levels also improve with ibrutinib but I think it's maybe too early to say for sure.